Hey again, Dr. Walker, DenWalker.com. Welcome back to the channel. I want to give a little quick discussion about treatment for migraine headaches. And I don't have them, but I see a lot of folks here, a lot of folks having treatment issues and concerns, and that they have some meds given to them by their PCP, and it sometimes doesn't work, sometimes it works, sometimes it doesn't work, and it's just a lot. And there's a lot of suffering that happens with that. And I just want to remind folks of a couple of things regarding, and again, I'm not saying that don't try their conventional treatment or their treatment, conventional or otherwise, but just kind of a reminder in terms of how migraines occur and some other things you can actually add to your toolbox to reduce your suffering and your pain from that. So number one, I remind folks that their hydration needs to be adequate, needs to be high, because if you're not hydrated well, that's a very common cause for headache and a very common cause specifically for migraine headaches. The next thing is your or electrolyte imbalance. There are folks who have lots and lots of water that they're drinking, and again, I encourage hydration. I do. But sometimes you can also decrease the overall mineralization of your system if you're drinking too much water, not having or having a process to mineralize your blood. So one thing I do recommend is for people who drink lots and lots of water, and really just in general drinking water, is to consider mineralizing your water before you drink it. So oftentimes people will use either organic Himalayan salt, or they'll use organic Celtic salt, or Baja. They can use that as well. But bottom line is you take a couple of granules of those salts and you add it to your water. And as you mentioned, I mentioned before, there are probably 82 plus trace elements, for example, in organic Himalayan salt or in Celtic sea salt. Add that, a little bit of that, to your water as you're drinking it towards the end of the day. And importantly, before you go to bed, and just trust me on this one little piece, if you add just a couple of granules of organic Himalayan salt or Celtic salt, put that in your water at night, and just a cup of water, and drink that probably every night. You're not going to get up and go to the restroom as many times as you think you're going to do that. That's not going to happen, right? But that helps to mineralize your system so that you're not having problems from demineralization throughout the day. That's the second one. And then the last thing I want to add is having magnesium, specifically magnesium oxide. And I know I tell a lot of folks all the time that what you should probably do at night to go to sleep is use magnesium glycinate, and that should help relax. And it does. What it does is sort of help relax your soft tissues, specifically help to relax your blood vessels, and again, relax your system in general, and helps you fall asleep and stay asleep because you're now relaxed. And magnesium glycinate, biglycinate, was sort of the ones I mentioned, 400 milligrams for men and 324 for women in general. But you could also then add magnesium oxide. Magnesium oxide is not very well absorbed by your system. Only about 20 to 25% of it actually gets fully absorbed by your system. But of the one time I would recommend magnesium oxide is for people that have migraine headaches or serial migraine headaches. So you can either do one or two things. You can either do the magnesium glycinate one night, or and then trade off the next night with magnesium oxide, or you can take your magnesium glycinate early in the day and then take your magnesium oxide towards the end of the day. So those three things. So number one, increase your hydration. Number two, remineralize your water using Baja, Celtic, Himalayan salt. Any of those things, just a couple of granules in your water, and that'll help significantly. And the last thing, again, is to add magnesium oxide towards the end of the day, towards the end of the night, I should say, as you're going to bed. Those three things should help. Now, it's not going to help you necessarily day one, but as you continue that whole process, make that a part of your normal night routine in going to bed. That should help you with the migraine headaches. And let me know how that works for you if you don't mind. Thanks for listening, Dr. Walker.